Maxed Out Man, helping you become the man you were made to be.
Hey guys, it's Kevin Davis from the Maxed Out Man podcast. I'm on episode number 33. Today I'm super excited for this one. I'm here with Amy Stuttle, who is an entrepreneur who has carved out, I'm going to read a little bit of her bio and let her go into more detail. Amy's an entrepreneur who carved her path in the world of health and wellness, and she's the founder of Victory Men's Health, a multi-location healthcare clinic that specializes in health optimization for men, health optimization. She also founded Victory RX, which is a telehealth company as well, and she does her own podcast, which is Women Want Strong Men. So I'm kind of wanting to split this podcast in two. We'll talk hormones and hormone health and men's health, and then also I want to talk more about that. And I think after reading this, and I think after this episode, I'll add Amy to my list of badass women I know, including my own wife of 28 years. So I'm super excited. So hey, thanks for coming. I appreciate you taking the time to do this. And I'd love to learn a little bit more about you. That's your basic, LinkedIn bio stuff, but I want to know from you specifically.
Well, congratulations on episode 32 from somebody
Thanks.
that has a podcast. The podcasts are a lot of work, and people do not realize how much goes into actually host your own podcast. So congratulations.
Thank you very much. Thanks.
Yeah, so I got started. I was always kind of had an entrepreneurial spirit. Like I was always in my head conjuring up that next idea and always had that fire in the belly for that. But Victory Men's Health spurred out of a health condition or a health situation that my husband had. So my husband, who I would consider an educated consumer, he is a chief operating officer for a spinal implant company, so also in healthcare, went into a local supplement store and purchased an over-the-counter supplement and ended up with liver failure.
Oh my gosh.
Yeah, so he was hospitalized for months, and it was an eye-opening experience for us. The hepatologist at the hospital was like, yeah, I see supplement-induced liver failure all the time. And I was like, what? How is that even possible? So it spurred this concept of like, why are men walking into a supplement store and buying these testosterone boosters versus going to a doctor? And so whenever I talk to my husband, like, okay, now that you're healthy, if you want to actually go get your hormones checked and start down this path, like, why don't we actually go see a doctor? So when we started to look at doctors in the area to go see, there were really no good options. I mean, I was like, whoa, it was like these high pressure sales places that were only focused on erectile dysfunction. And then you had the contrary, the physicians that were mainly treating women and doing pellets. So I was like, you know what? We're both in the healthcare space. I was in medical sales at the time, and I also owned a gym. I was like, I think I want to do it. So that's where it came from. And I was like, we can do this better. It's going to be a high-end facility. We're going to have actual physicians that see the patients. We're going to break down the stigma that surrounds hormones, because it's typically associated with erectile dysfunction, and that's not true. That is false information. And let's build a brand around this topic and see if we can break down these stigmas and get men talking about it and wanting to come in and see us. And that's what we did. We've been in business 7 years now. It's called Victory Men's Health. We're located in the St. Louis market. I have 3 locations with a 4th one on the way, and then we have the telehealth company as well.
That's awesome. I think it's rare now, really. That's an awesome niche for you, because I think now what we have are options where we go to a local doctor who doesn't know anything about hormone management, or we go to, like you said, the high pressure, salespeople and those clinics that may or may not know what they're talking about, may or not want to look at what you're doing. So yeah, that's definitely a niche that needs to be filled.
And I don't want to pick on your primary care doctor here, but it's not really their fault. I mean, they learned hormones, for one day 20 years ago. I mean, it's really not their specialty. And they're seeing so many other conditions and trying to save people's lives. And there's just a lot. It's fast paced. I mean, hospitals typically own them. They're trying to jam 20, 30 patients in a day. So in all fairness to them, it's hard for them to really get in the weeds and be able to treat your hormones. It's also not something that insurance companies want to cover. So now you're looking at a cash pay situation. And if the hospital owns the primary care office, that's not something they're interested in. I mean, this is an insurance-based model. So there's a lot going on there why the primary care doctor can't really properly properly treat your hormones. So yeah, there's definitely a need for specialties for men and women. I recently helped a urologist and a female doctor open a women's health clinic, and I couldn't believe how underserved that area was too, because I was always kind of like, females have the OBGYNs to go to, they're more proactive in their health care, so they have better options than men have. But I'm starting to learn that that's really not the case. Men and women have both been underserved in this area of health optimization and hormones.
Yeah, it's funny because my wife gets pissed off at me because she's like, dude, you literally can shoot yourself in the ass twice a week, get your numbers where they need to be, and now you feel like you're 20 years younger, like you should. And she's like, her particular doctors have not been able to help her with that. And so it's something that for women, even though we've talked about HRT and all that, there's this fear about the risks associated with HRT with them and all that. So that's definitely a market that, I don't think it's served.
Yeah, and that's unfortunate. There was a study done with estradiol several years ago that started these misconceptions around hormones for women. And it was kind of like the same with men, how the testosterone and the prostate cancer misconception started. And it takes a long time to claw that back and to bring people up to speed with the new information and the new studies and to break down those concerns. But yeah, it sounds like your wife maybe needs to see a specialist because, I'm on hormones myself. I take testosterone. Now, I do a cream. I'm not on the injections, but there's plenty of women that also do a low dose injection. And then I'm also on progesterone. I'm not in menopause, so I don't need to take any estradiol. But I think even if you're a young female, like I guess I consider myself young, I'm in my 30s. I have a child, and I don't think there's any female walking around on the face of the planet that has birthed a child whose hormones are actually balanced. Okay,
right.
So I'm definitely a proponent of women optimizing their hormones as well.
Yeah, so I think maybe we need to have her reach out. But she just turned 50. She's still premenopausal, which is actually kind of rare at 50 for the most part. So she's still kind of doing that. But she was like, well, if I take testosterone, then I have all these, I grow facial hair and all these different things that can happen. I don't have any facial hair.
No. If you're taking high doses of testosterone, yeah, sure. Maybe a female starts to grow facial hair or voice changes and stuff. But if you're taking a low dose testosterone, that's really not something that we see or something that's not manageable by any stretch of the means. So women need testosterone, and premenopausal women are the most underserved, and symptoms get brushed under the rugs more than anybody. And they're typically the ones experiencing the most side effects from the hormones change prior to getting into menopause. So I feel terrible for the women that are suffering in perimenopause and that their doctors aren't treating them until they get to menopause. It's definitely an area where you want to be treating your hormones.
Yeah, because in her case, it's literally like her primary care physician's like, well, this is your life now, basically.
No.
It's the diagnosis for her.
Yeah.
And it's frustrating for her because, she's seeing stuff like, obviously, desire, libido is an issue.
Yeah.
The hair growth and all of those things, but tiredness and memory things that she's starting to see,
right,
which frustrates the crap out of her, I'm sure. And so all of these things, and you don't really think about it in terms of, hey, this is an area that is just largely ignored.
Yes, and those are all the classic symptoms, and you don't have to be okay with them, and you can definitely treat those.
Yeah. So our audience on this for Max Out Man's largely men of a certain age, but they're married. Most of them are married to women. So if your wife is dealing with some of these things, as we talk about testosterone, as we talk about hormone management and wellness, it's not just for men. There are things that can be done with that. Can you walk me through? So let's assume that the people listening don't really know much about testosterone, don't really know much about health and wellness. And side note, my degree's in exercise physiology, and I ran health clubs for the first 5 years of my career. So it's funny how we have that connection. Yeah. But kind of walk me through what that, because a lot of men really don't know anything about it, or they don't really have, the basic knowledge on, because what do you think? You think, oh, well, this dude at the gym is doing 200 milligrams every 3 days, and he looks like, Dwayne "The Rock" Johnson, who, by the way, is also on steroids. But, Walk me through that.
Yeah. Well, I guess because that's probably a misconception that if you don't want to be on hormones because you think you're going to be like this roided out huge gym guy, that's not actually the case. But we're really in a low T epidemic, and we have men that come in with their father, and the father always, I don't know if I can think of a situation where the son has a higher testosterone level than the father. And that's because look around us with these plastics and what's being injected into our food and what's in our water system. And it's just like, so the lab levels for testosterone keep getting lower and lower and lower and lower because they adjust to what the norm population is, right? So now we're becoming okay with these lower and lower testosterone levels because they're, quote, in range. And it's really frustrating. So
talk more about that, because I don't think a lot of people understand exactly what these norms, what they do, right? Talk a little bit more about that.
So a normal testosterone reference range from, let's say, a LabCorp request might be anywhere from 250. I'm talking in total testosterone here, not free testosterone, when free testosterone is actually the most important because that's what's available to your body. But let's just talk in terms of total testosterone because that's what most men are, if they have it run by their primary, are seeing. So the T level is typically somewhere between 250 to 800 on this reference range. Well, that is a huge range, right? A 250 level might be, quote, normal for a 70-year-old man, but that should not be normal and acceptable for a 40-year-old man or a 50-year-old man. I mean, you're really wanting to be in these upper levels of normal and even potentially surpass that depending on what your testosterone levels were whenever you were younger. You don't treat the number, you treat the symptoms. So a lot of times you're going in to see your primary care doctor, they run the total testosterone and you're, quote, in this range, right? Not under 250, and they're like, "Well, you're fine. You're in range." That is not the case. I mean, you're wanting to treat that if you're in those levels, and if you have symptoms, you're definitely wanting to treat that. So don't you got to kind of be your own health advocate here. Don't just take your doctor's word for it. You actually want to be, if you're having these symptoms, laying eyes on your labs, knowing what your numbers are, and tracking that information.
Yeah, I think that's important across the board for healthcare. We have I live outside of Bozeman, Montana, and we have fairly substandard healthcare here, just because it's fewer doctors, more hospital control, more insurance-based stuff, all that. And, in my case, so I try to be my own advocate as I get older for anything medical. It's like, I don't assume that they know more than I do necessarily. They do, but I need to advocate for myself. I think my number was definitely sub 300. And I'm 50. I had that tested when I was 44, 45. And the doctor's like, "Well, you're in your normal range." I'm like, "Well, if you need me, I'll be crying in the back of my closet, 30 pounds overweight." It's like, it's just crazy.
Yeah. Yep. Yeah, I know for sure. And a lot of times that has to do with insurance too, because the insurance company doesn't want to cover it unless you've had 2 blood draws in the morning. You fall outside of that range. So again, these primary care doctors are also pigeonholed into this model. And that's why most of these hormones clinics are a cash pay business, because that's the only way to typically optimize hormones the way they should be.
Yeah, so that's, definitely, and we're not trying to demonize the, primary care physicians, because like you said, whether it's nutrition or fitness or hormones or anything, they have to treat, they're trying to treat all of those things, and they have major restrictions. My daughter is a paramedic, and she's actually pre-med now, and I'm like, when she first started talking about it, I'm like, "Have you talked to any actual physicians in the last 5 years about being a physician? Like, is this, make sure this is something you really know what you're getting into, because I don't think it's getting better, for us in particular."
Yeah, she's probably not going to want to go work for a big hospital system.
Yeah, for sure. So what are those symptoms? I kind of interrupted you as you were kind of giving us the basics of TRT, or testosterone hormone wellness, and all that.
Yeah, there's a lot of different symptoms, and some of them you mentioned earlier, from brain fog, loss of muscle mass, sleep quality, erectile function, sex drive. I mean, all these things are symptoms of low testosterone. And there's things that testosterone are needed that maybe you don't have symptoms of. I mean, you need it for cardiovascular health. You need it for nitric oxide production. So there's things that it's doing inside your body that you're maybe, not aware of. So there's other benefits to TRT besides just those symptom relief.
Yeah, because I don't know that you could call it a catalyst hormone, but it's like especially for men and women, but obviously for men, it's a very important hormone. And I think that we don't really give enough credit and attention to it.
Yeah, there's a lot of downstream effects that testosterone or impacts that it has on the body. And yeah, for a long time, it's kind of been shoved to the side, like it's maybe not important. I think we've realized as healthcare has progressed that optimizing your hormones is extremely important if you want to live your best life and you want to live a long, healthy life. I mean, even look as you get older with maintaining muscle mass. I mean, the day that you can't bend over and tie your own shoes, you have a major problem. Or the day you can't get up out of your chair on your own, you have a major problem, right? And so just maintaining that muscle mass as you age is critically important, and testosterone for men and women will play a big impact in that. And kind of back to when we were talking about this reference range and optimizing your hormones, and we were talking about the gym person and steroids, and testosterone is banned from professional sports for a reason, right? Because it gives people an edge. Okay, it gives these athletes an advantage. So it's always confusing for me whenever people want to dump it into this category of this steroid abuse, and they don't want to be any part of it. It's like it's banned from professional sports because it's giving people an advantage. If you're the normal layperson, why wouldn't you want that? Like, you want the edge. Nobody's banning you from taking it in your day-to-day life. You're not a professional athlete. So if you can take it, if you need it, why wouldn't you want that?
Because I mean, it's literally called performance enhancing, right?
Yeah.
Like, who doesn't want better performance in their daily life if they could have it?
Nobody that I hang out with, I can tell you that. I mean, I'm just like, hello.
Yeah.
So why do you want to be average? Let's go be
great.
Mean,
it changed my life. And I had another guy on my podcast that is kind of in this space, and we talked about the, TRT or no TRT game that I play. I don't know if you do this as well, but like, I'll walk through the airport and I'll see a guy and be like, about my age, like I said, I'm 50, be like, that dude's on TRT, that dude's on TRT, that guy needs to be on TRT, but he's not,
Yeah.
So playing that game.
We play that game, and then we also play it with, like, have they ever played any sports in their life? And
oh yeah.
We judge people based on that with my son. I'm not sure what we're teaching him, but it's kind of fun.
Hey, I always tell my girls, stereotypes exist for a reason, right? Yeah. So it's okay to put the people in stereotypes just a little bit. So I think so if 800 is the top on sort of the accepted range, and again, we should probably state up front that this is not medical advice, blah, 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 blah. See your primary care physician, all that. We're not giving medical advice. This is just basic information. I don't know why we have to say that, but there you go. What kind of ranges are you seeing? And let's just talk testosterone for now, but I do want to get into more of the whole, the whole wellness picture, holistic wellness picture. What kind of numbers are you seeing for people to be maximum? I think I run 11 or 1200 somewhere in there, and that's like my base. That's like where I need to be, there a little bit higher.
Yeah, so I guess I should say too, I'm not a medical provider. I'm a business owner. I'm not in the clinic, which I'm pointing over here because it's attached to where I do the podcast at. So I'm not treating people. I'm not interacting with them clinically, but I obviously built this business. I was the patient coordinator. I go to all these conferences. I interview a lot of doctors, and we have a lot of interaction here at the clinic, but I'm not the one personally treating them. So the reference range, like I mentioned, 800 typically sits at the higher end. We typically see symptom relief probably in that 800 to 1200 range. Here's the problem. A lot of times, unfortunately, this range can be dictated by attorneys, right? People that are sue happy. So sometimes doctors get uncomfortable pushing people up over, it could be 800, it could be 1200, their number. It depends on the doctor. But then you have other doctors that I've had on the podcast that are like, hey, if they still have symptoms, I'm pushing them up to 2000. They don't care. They keep go until they get the symptom relief. So it really just depends on who's treating you and what their like, risk diversion is here. But I would say that on average, when men are getting up over that 800 range, typically they're seeing symptom relief. But it also is tied back to their free testosterone. And it depends on like sex binding globulin and stuff like that. But typically they are directly correlated with one another. So that's where we're typically seeing symptom relief at.
Yeah, and I mean, I'm fortunate because I have a naturopath. So I originally started out with a clinic in Florida, of course, is because that's where like 90% of them are.
Yeah.
But I don't know what it is about the Florida law that makes
Texas.
that makes that attractive for that. But like, and then I'm fortunate because I actually have a naturopath that, whether this is a good thing or a bad thing as a doctor, I can say, hey, here's my numbers. This is what I need. Can you write me a prescription and keep my testosterone flowing? And he trusts, I show him my labs, I redo labs and all that stuff. So he's not doing anything unethically, but that's fortunate to be able to kind of self-manage those things a little bit. But I'm also not incorporating stuff. I did originally have HCG. I did originally do some anastrozole for estradiol, and I don't, we killed that, and that was actually at his behest. He was like, you need estrogen in your body. Yes. You can't limit that.
That's a common mistake that we see, or people come from other clinics and they're on an AI, anastrozole. You do not want to be on one of those. I mean, an anastrozole treats breast cancer. I mean, why would you want to be putting in a chemical that harsh into your body? I mean, there's thoughts that estradiol, because testosterone converts into estradiol, that might actually be where all the benefit of testosterone is coming from for a man. So you don't want to block it. You want your body doing it naturally. And if you're concerned about it, or if you're chasing some number, you can quote control your estradiol by how you give and administer your testosterone more frequently, or doing creams versus injectables, or whatever it may be for that person's unique physique. But you do not want to be blocking estradiol. And there's really no need to be on HCG either right out of the gate. I mean, some people get on it in conjunction with some other things for maybe fertility, or they're worried about testicular shrinkage, and then you would get on it. But you should not, day one, you're starting hormones and get on testosterone and HCG at the same time. But we do see a lot of clinics, they start patients on testosterone, an estrogen blocker, and HCG all at the same time, or even worse, because HCG has gotten extremely difficult to get for some clinics.
Yeah, it's basically impossible to get.
So we still get it. We have a good relationship with our pharmacy, and we can get the commercial brand. But basically, the FDA changed it to a biologic, and compound pharmacies are not supposed to be making it anymore. So anyway, people have switched to Clomid, prescribing Clomid and an AI and testosterone, and Clomid and HCG are not the same thing, and you do not want to be taking Clomid at the same time as you're taking testosterone. It's just a mess, but we do see that mistake commonly from patients from other clinics.
And can you dig into some of that? I mean, I think we're talking, you and I understand this stuff because we're, and you understand it 10 times better than I do. But in terms, like, that's kind of the cocktail that they put you on. But I'd love to kind of, can you help me understand, or help the listeners understand the mechanics of how those things fit together, and then what the alternatives are, and kind of what your process is. And let's dig into kind of the holistic side of health and wellness, right? Because it's not just shoot yourself in the ass or thigh a couple times a week and go on with your life.
Yeah. So I guess other clinics, I'm speculating, put the man on testosterone and an AI and HCG because they're trying to get out in front of these, quote, side effects that have been conjured up on the way from bro boards and bodybuilding.
I like that bro boards. That's it. I haven't heard.
Hey, I'm on these bro boards, so I love being on the bro boards and reading what the things people come up with. I'm like, oh my gosh, this has never even crossed my mind. This is crazy. So they're getting put on an AI anastrozole to block estrogen, and we just talked about this. You do not want to be blocking estrogen, so that's why they're throwing in that in there, because somewhere along the way, bodybuilders, thought their estradiol needed to be totally bottomed out to get the leanest physique that you could possibly get. That's not the case. So majority clinics that are on top of the latest research and go to these big conferences that I go to, majority of these clinics are dropping anastrozole, just like you said that your doctor told you, like, let's stop doing this. And then the HCG gets drug in for the testicular shrinkage, or maybe wanting to keep your sperm count up. And so that's why that's getting tossed into the mix. So they're trying to do too many things at one time. Like, you don't need all of that, and to introduce that many different things to your body at one time is not the best method to go about it. And at our clinic, we offer all the different types of testosterone. We don't just say we only do shots, or we only do pellets, or we only do creams. It's like everybody's different, and at the end of the day, it's just trying to get the patient the best results and what the patient's going to be compliant on. Because if the patient's not compliant, if the patient has a needle phobia, like, what good are we talking about testosterone injections? Like, we have to come from a different angle. So we do the injections. We do them intermuscularly, or we do them sub-Q, which means like in the fat, typically in the belly, hip area, wherever the patient feels comfortable. But that's like a small diabetes needle, and typically
like 31 gauge or whatever
correct.
It is. Yeah.
Yeah. It can be a little tricky though, because testosterone's thicker, oil based, so either why it's lower dosing, there's an injection technique there. You don't want to break off the needle or anything like that. But we do have patients that like to do it sub-Q, and they inject more frequently because you're injecting more a lower dose. And then because
the viscosity of testosterone cypionate, and it may be in grapeseed oil or some other oils. Like, I actually tried a couple of times to do the smaller needle. I do like a 27 gauge now in my hip, but like, I tried, and I'm like, honey, I'm going to go inject my testosterone now. I'll be back in a half hour by the time I get this out of the syringe. And
you bring up a great point. It frustrates the crap out of me. Like, we do YouTube videos training people, and these bros will get on there and be like, dude, that needle's too big. Like, dude, you're using the wrong needle. That needle can be small. I'm like, stop talking. Like, not everybody wants to inject for 30 minutes and try to push this thick oil out. Like, people want to be in and out quick, and they want to use a larger needle size to do that. And we would agree with that in the clinic. Like, you don't want to be sitting there with that needle and they're shaking, trying to push that in. So it's like, no, different things work for different people. Like, and we do the testosterone cream, and we do the cream transscrotal versus, just applying it on the arms or the inner thighs. Like, some guys might apply it transscrotal and then do like the leftovers on the arm, or they might do one click on the arm. Some people will do that once a day. Some people will do that twice a day. We've nicknamed it ball butter. And so sometimes, like, it's a little too thick, like, to put it on all at one time. So they might split the dose to twice a day. But it's a phenomenal way to administer testosterone. And it's probably one of our best ways that we recommend guys to administer the testosterone is.
And how does that work with your partner? Because I know that's one of the kind of concern, quote unquote, concerns with creams is, transfer and all that.
Yeah, I mean, you just have to let it dry. I mean, you're not going to go. You don't want to go put it on and get in bed with her, or maybe you do, because it might actually work to your favor. But usually it's a non-concern. You're not gonna like, you don't want to put it on and then pick up your kid where it's still sticky and tacky and transferable. But usually
once it dries, it's absorbed, and then you're not concerned with that. I mean, I guess if you had put it on 20 minutes ago and had some like super sweaty thing going on, you could get some, but it's probably.
I think that the pharmacy inserts has something like 30 minutes to wait, something like that. But it dries pretty quickly.
Hey guys, thanks for listening to this episode. I hope you're enjoying it and learning a lot. If you're looking for extra help, don't forget that I do offer one-on-one coaching. We can talk through a ton of different issues. I can give you guides, guidelines, and logistical help to help you take that next step or go to that next level in some of the things that you're dealing with in your life. We also have some course content, some guides, and a lot of educational materials over at maxedoutman.com. For the coaching, go ahead and go to maxedoutman.com/coaching, and you can learn about that. And then just go to maxedoutman.com for everything else. Thanks for joining us. Now back to the episode.
And then we also do pellets. It's probably our least favorite way, or not probably, it is our least favorite way to deliver testosterone to a man. And it's a little incision given in the glute hip area, and the pellets look like Tic Tacs, I would say. And you make different paths or tunnels, and you insert these Tic Tac looking testosterone things into the glute hip, and then it doesn't require a stitch or anything. You can butterfly it shut, but then you can't work out or swim or anything for a few days as that heals. But it does run the risk of extrusions potentially. But it is nice for the guys that don't have any interest in being compliant in anything. Like, I'm not going to give myself a shot, once, twice, 3 times a week, whatever your regimen is. I'm not going to apply a testosterone cream transcrotally or on my arm. So then what's our last option? It would be testosterone pellets.
I actually just learned about those, and I understand the advantages. I understand why somebody would want to go that, but it sounds horrendous.
Yeah. I mean, I've been in the room when they've been placed, and I wouldn't say that I would be excited to get one. And for women, I think it's different. It's very common for the women that have the testosterone pellets inserted, because they're typically only inserting 1, maybe 2 pellets, where with a man, you're getting 8, 9, 10 pellets inserted. So these tracks are a couple inches long, that they're being placed with what's called a trocar, and it does not look like something that I would want. Now the guy's numbed and they don't feel it, but again, for the guy that travels a lot and doesn't want to deal with it, they like it, and they don't have any issues with it. So
yeah, it's funny because I don't really have a fear of needles, but it's hilarious because I've probably given myself 1,000 injections at this point. Not quite that, maybe 400 or 500, but every time I get ready to jam myself, I'm afraid before because and in my case, I actually draw in with a 21 gauge needle, and then I switch the needle out to a 27.
Yep.
And that still takes a long time. 27 is, but if you try to use the 21, I mean, that hurts like hell. So
yeah, no, I would say that most of our patients are using between a 25 and a 27 gauge. Most commonly.
And honestly, it doesn't hurt that much. What I found actually, and I kind of had to do some research, but I actually I load the needle and then I heat it slightly, the syringe, the liquid, under hot water, mildly hot water, and that seems to help the viscosity a little bit, at least, depending on how cold it is. We're in Montana, so it gets cold. So,
well, you can always look at testosterone cream. It works really well, and it even increases, has a better impact on your DHT levels. So that is more beneficial to the man as well, if you can get your DHT
and that's a
levels
prescription
higher.
too. You just get the prescription, just like you would with the injectable stuff.
Correct.
For sure.
Yep.
And how often do you? So I give mine. I've learned that if I, my kind of up and down flow, if I do Sunday night and Thursday night is typically when because that's 3.5 days, somewhere in there. Is that kind of the same schedule you do with cream, or how often are you doing with cream?
No, the creams you're applying every single day.
Oh, okay.
Yeah.
So it's just kind of part of your morning routine,
Correct.
so to speak. Okay.
Correct. Yep. Just get out of the shower and put it on. But like I said, some people are doing it twice a day, so morning and evening. But it just depends. Everybody varies.
Yeah. And with the HCG stuff, I mean, I was reading some stuff the other day that there are a couple, if you're a single man, and actually it was interesting because they said gay men typically have more, they did this survey, and they said gay men have more of an issue with testicular shrinkage than heterosexual men, which I thought was it. Yeah, I'd have to, if I could find that article, I sent it to you, but I thought that was really interesting.
Yeah, I haven't read that article. I mean, just from a female's perspective, I don't really think a man needs to be worried about their testicular size. Like, if anything, it's actually making your unit look bigger. So maybe just embrace it. But seriously, like, no, I don't know a female that's like, oh wow, I wish my husband's balls were bigger. It's not really a thing. So I don't think really need to stress about it. But I know I have read papers that there's like some psychological component for men and their manhood and like, wanting it to be normal size. So that's fine if that's how a man
that's your
feels.
thing,
But
yeah.
I'm just saying, from a female's perspective, I don't think a man needs to be stressed about it. Like, I don't think you need to be taking HCG to please a female partner, more than likely.
Yeah, and what's interesting, I talked about this on another podcast. I had a motorcycle accident that I actually fractured one of my testicles. So like
Ouch.
that, yeah. So which actually affected my testosterone long term, and didn't affect my ability to have children. We had 2 after that, but. Like if that one's already that way, then who cares?
Yeah, don't stress
Because
about it.
they don't retain full size after being fractured. Let me just say that. So that's not really an issue. So so it sounds like definitely between the creams and the injections, there's not really pharmacologically, there's not really that much of a difference. It's just more of a convenience thing, or like how do you determine the recommendation to make?
A lot of times it's compliance, or if a guy isn't getting the result that they want on one, we might recommend another. We'll play around with their regimen, but I would say it's pretty close to a 50-50 split.
Interesting.
On our patients that are on a cream versus an injection. And it's got to be a compounded cream. It's not like an androgel. I'm not talking about that. It doesn't work the same. You can't put gel on transscrotally. That's a totally different thing. You definitely need a compounded testosterone cream.
And does that fall in the same compounding pharmacies that you're dealing with on stuff like HCG? Like, is it limited, or you find that there's your local pharmacy can probably get it?
We use a compound pharmacy for just about everything that we do here. I mean, we're not calling the scripts into a local Walgreens or CVS. We compound everything specific to our patient, and we don't have any supply issues or raw material issues there.
That's good.
Yeah.
So I know for a clinic like yours, who actually you take like a whole wellness, a holistic wellness kind of approach. Can you walk me through that? Because I think a lot of people sometimes will be like, well, I feel like crap. I'm going to get this XYZ drug. And in this case, we're talking testosterone therapy, and it's going to fix everything, and I don't have to do anything else, right? Like, what's the overall, what's kind of the overall education that you do for your patients to help them, like you said, live their best life and to maximize? Because I work out 6 days a week. I do cardio 6 or 7 days a week. I try to eat right, good protein, not a ton of supplements, but all of that stuff. So that's like my whole regimen. Like, I do all of these things.
Yeah, so we're not just a testosterone clinic. We do several different things. We do the hormone optimization. We do the sexual health, erectile dysfunction. We do weight loss. We do vitamin IV infusions. And then we have what's called like a Victory VIP, where we get more into gut health testing, that type of stuff that takes a little bit more time, food sensitivities. But we start with a pretty large blood work panel and look at the overall, totality of your health. And so we're running CBCs and iron and prolactin and hemoglobin A1C and PSA and all the hormones, thyroid. I'm trying to think of it. I mean, it's a pretty large panel to get a picture of what's going on. And we do, health intake form too, to understand your lifestyle, how you're working out, how you're eating, all of those things. So whenever we meet with you, we take all those things into consideration and have the conversation around that. Our providers, our doctors, and our nurse practitioners, like they practice what they preach, and they are also into health and nutrition and exercise. So they are getting in the weeds with you about that, because it's not, at the end of the day, it's not just a miracle drug. You have to put in the work too. And hopefully the testosterone can motivate you to go put in the work, and people start to see results. And once they start to see results, that kind of snowballs into them buying in and then maybe making better eating decisions, or going to the gym that one extra day, or lifting more weights, or whatever that might be. That's what we find, is that once we get them motivated to do it, they start to see results. It can be life changing. Like, we had a patient in yesterday that lost 100 pounds in 6 months. I mean, think about that. 100 pounds. I mean, that's crazy, in 6 months. So, and that's the power of the mind and testosterone, and putting in the work and supplying you with the hormones or the medication that you need to get it done. So it's pretty incredible. But we have some pretty cool blood panels. Like, we do the IV drips, and we can run what's called a micronutrient test on you, and it looks at all the vitamin minerals in your body and tells you what you're absorbing at a cellular level. So at a white blood cell level versus like your typical serum test, which is a red blood cell test. And it tells you what your body's actually absorbing and what you're deficient in, and then we can custom make your vitamin packs, or we can custom make an IV to just supplement what you're deficient in. Because so often you're just like grabbing off the shelf at Target or Walgreens or whatever, like assuming that you need this because you heard turmeric was good, or you heard that you needed CoQ10, or you heard that you needed a daily vitamin. But when you take stuff that you don't need, you can actually induce another deficiency. So if you actually know what your body needs and you just supplement accordingly, I mean, that's the best way to get optimized. And then when we start to look at some of the gut health stuff, people have a hard time understanding the difference between food sensitivities and food allergies. But the gut lining, when you're eating things that your body is sensitive to, has a food sensitivity to, the lining of your gut will kind of start to break open, and that leaks into your bloodstream, and you're having inflammatory reactions, and your body's constantly fighting that off. So if you know what those food triggers are for you, your symptoms might be just like, oh, I had some slight bloating, or maybe you had diarrhea, or maybe like stuff that people might be blowing off, when really what your body's having to do to combat that with inflammation really does impact your longevity and your overall health. So there's like a lot of things that we look at, and it also depends on how invested the guy wants to be. And sometimes that comes in stages. Sometimes it can't be all in one visit that we're getting through all this. But once they buy in and start to see changes, usually, they come along for the ride on some of these other things. So it's pretty cool to see the impact that it has.
Yeah, because we're kind of talking a little bit of boutique medicine kind of thing. It's not cheap because it's extensive, right? Like, you're not going to go in and just get this stuff from your average doctor and they bill it to insurance and you pay your $20 copay, right? Like, it's an investment in your health. Right.
And I mean, it's not, testosterone, I would say, is running people, in that $150-ish range a month. So I think, when you look at the cost of it, I think if people want to make it a priority, they can make it a priority. And you're not paying, at least with us, you're not paying to come back and see us every single time. It's like, it's a service that's your medication and our expertise and your office visits are kind of all under one umbrella. So, if people are like, well, why don't you take insurance? Well, one, we couldn't optimize you the way we want to. And secondly, you got to look at it. You're not coming and paying a copay every time you see us. If we flip the model and charge you every single time that you saw us, which is every couple of weeks, I mean, yeah, you're probably going to be spending more in that case, and we'd be billing your insurance. So I really think that if people want it, they can set aside the resources to make it work.
Hey guys, thanks for listening to this episode. I hope you're enjoying it and learning a lot. If you're looking for extra help, don't forget that I do offer one-on-one coaching. We can talk through a ton of different issues. I can give you guides, guidelines, and logistical help to help you take that next step or go to that next level in some of the things that you're dealing with in your life. We also have some course content, some guides, and a lot of educational materials over at maxedoutman.com. For the coaching, go ahead and go to maxedoutman.com/coaching, and you can learn about that. And then just go to maxedoutman.com for everything else. Thanks for joining us. Now back to the episode. Well, I mean, I don't drink Starbucks because I'm a cheap bastard, but like $5 a day. Yeah. Is super easy to spend. And I'm telling you right now, I like my caffeine too, but you're not going to get out of caffeine what you get out of something like testosterone replacement therapy. There's just it's just Like it literally changed my life. I've been a workout guy forever. I started losing muscle mass. I started, I've never been a great sleeper, and that's just how my system is. I need about 6 hours, and I function best on that, which is counterintuitive to what people will say. But it works for me. But in a depression, anxiety, and like no motivation and all of those things. And once I got on testosterone, it literally changed my life. Like I don't want to understate how important this stuff is.
Yeah, that was with my husband. The sleep was the biggest thing that I noticed because he was like always wrestling around in his sleep, and it drove me crazy. I'm like, oh my gosh, you're keeping me up all night with this. But whenever he got on testosterone, it like changed almost immediately. It was crazy and extremely refreshing. So that's probably the number one thing that he tells people that ask him about getting on it or curious about what we do. He's like, the sleep. I cannot believe how it changed the sleep. And sleep is extremely important. And like I wear this Aura ring right here. I track my sleep. I'm very into my sleep, how much deep sleep, REM sleep that I'm getting. So you don't underestimate the importance of the sleep.
Yeah, and I'm saying this is me in particular. It's funny, I do the sleep. I don't have an Aura ring. I've actually looked at them, but I'll do sleep apps or whatever. And I always say that I have a switch like a robot. Like literally, if I'm not asleep within 2 or 3 minutes when I go lay down, it's like
rare.
It's rare. It's very rare. But when you watch the sleep, it's literally awake, deep sleep for 6 hours, awake again. Like I have the weirdest, like the way my system works that way. And I've done a lot of research on it to try to say, well, is this, I'm just screwed up or what's happening? It's actually, there's a little bit of I don't know if they call it a syndrome or something, but there's actually a certain percentage of the population that functions like this. And so
if you're getting 6 hours, that's decent. You're typically shooting for 8, but if you're getting 6 hours of quality sleep, that's great.
Yeah, I'm big on efficiency for whatever reason on everything I do. So evidently, God just made me in a way that I could do that with sleep as well. If I go to bed at sometimes Michelle, my wife, is tired and we'll go to sleep a little bit earlier, 9:30 or whatever. I'm up at 4:30 in the morning because my body's just like, I'm up. I'm awake. So that's just kind of how it works. But I know for a lot of people that sleep disruption, it kills you. My wife she's a 9-hour girl. She functions best on 9 hours, which almost everybody that gets marries someone that needs less sleep than the other, or one's a morning person, one's a night person. That's kind of how
might
that
be
works.
Our chronotype. But the most important thing is getting into that deep sleep. So as long as you can manage that. And I'm kind of a freak. I use these red light blocking glasses, red blue light blocking glasses that I'm wearing prior to winding down for bed, because it starts to trick your body to think that it's time to shut off, so you can get into that deep sleep faster.
Interesting.
And you can get into it longer. So
and you're not on your phone at night or anything like that, right?
I'll be on my phone with those on, so I'm not picking up now there's a setting in your iPhone that on everybody's iPhones that you can turn off that blue light. They call it like dark mode, but it's still not perfect. And if you're getting like lights from your lamps or whatever, so I wear those like the last hour before I go to bed. If I'm picking up or running around the house, whatever I'm doing, I have them on. So.
Interesting. I didn't even know that was a thing.
Yeah, and my ring reflects the difference. So I can get up over 3 hours of deep sleep whenever I have if I wear the red light blocking glasses. But if I don't wear the glasses, I'm typically like an hour, 45 minutes of deep sleep. That's not counting. I'm not talking REM sleep. I'm talking the deep sleep.
Deep sleep.
Yeah.
Well, I'll have to look into that. My wife, being again in that pre and perimenopausal state, she wakes up almost at the same time every night, which I think has this, it has a cycle anyway. But the only way she can put herself back to sleep is to get on her phone. She's a baker.
Oh no.
And so she gets on. So we've had this discussion. She's like, I literally cannot. If I sit there and just stare into the dark, I will never go back to sleep. But she's a baker. And so she's on every possible baking Facebook groups. And so she's literally just reading. You know, she's doing all those things. So
Well,
I'll have to look into this.
She's going to need to put the glasses on, because the minute you look at your phone and see that light in the middle of the night, your body just like, you have to reset it again. So I would definitely be looking at those glasses if I was her.
Yeah, well, I'm going to,
They're
I'll
not
be
cute.
like,
They're not cute. They're not.
well, I'm probably asleep at that point. So, she doesn't need to be looking cute at 3 a.m. anyway, I guess. But, so anything else that you want to talk about in terms of I want to talk about the podcast and kind of what you're doing there, but anything else that you want to give advice about, testosterone therapy, working out, any of those kind of things to kind of help the audience understand this a little bit better?
I mean, I think the main thing, if I was a man listening to this, is I would at least want to know my baseline, what my testosterone levels are. Even if today I don't have symptoms, and I'm 25 years old or 30 years old, I would want to know what my T levels are. So as you age, you can know what your levels were when you did feel good. So most of the time, men aren't getting this checked until they're symptomatic, right? So,
right.
I'm already running these tests on my little kiddo here. Like we're running a spreadsheet and keeping track of all this. So that would be the thing. I was like, take control of your own health care. Even if insurance isn't covering it, you can get online and get these online places that you can order your own labs even without a doctor's order, or there's this Rupa Health. There's all sorts of resources these days where you can take control of your own health and customize a panel that you want to see, not wait for your doctor to order it. So that's what I would say to the.
Yeah, I mean, I wish I had the data from when I was 20, 25 and 4% body fat and working out, all the time. I would have loved to have that data point. Of course, this was, that's in late 80s, early 90s. So we didn't exactly, that wasn't a normal thing that you would do. But that's great advice. And honestly, it's not that expensive. Even if you're not going to, a facility like yours or doing telehealth through what you guys do, it's not that. We have walk-in clinics. I can go in and get most of a panel for $150 or less.
Yeah.
And so it's not hard to get. It's not like you have to get a doctor's order in order to go to a lab to get this, which I think is a misconception that a lot of people have. It's like, well, I have to go to the doctor then. And well, no, just they're walk-in blood clinics everywhere. Some are better than others, obviously.
Yeah.
But, and so like if I wanted to work with you guys on that side of the coin, does your telehealth, and I know that stupid FDA is getting involved and trying to screw with telehealth stuff again, which honestly, I think telehealth was the biggest advantage coming out of COVID, because I hate going to the doctor, especially for like, if I need to talk about mental health or whatever, it's like, just get me on there and do that thing. Is all of this stuff that I can do through the telehealth side if I can't get to St. Louis come visit you guys?
So right now our Victory RX, it's called, is just for PDE5s, which is like Viagra, Cialis, Levitra. We're not doing our testosterone through our telehealth. Right now our policy is still we need to see you in person one time, lay eyes on you. We have an in-body body composition scale that we like to get people on, so we know their lean muscle mass, their body fat percentage, all of those things. So to see us for hormones, unfortunately, you still have to come see one of our clinics in the St. Louis area. But for the PDE5s, for the sexual health side, we are doing it through Victory RX. And I hope to someday, the laws are a little confusing and a little gray. They kind of like leave enough to be interpreted to get somebody in trouble if they really wanted to, in my opinion. Like, it's still like, I don't know. And with the COVID laws swinging back and forth, we haven't made the investment into doing a controlled substance in multiple states via telehealth yet, but I hope that it's something that we can eventually offer and do. I'm keeping an eye on it. I'm trying to build the platform and the system to make it a smooth process for guys. Like right now, our Victory RX is just a text to telehealth. So you don't have to create a portal. You don't have to create a login. You literally text us, hey, I want those pills that I just heard you talk about. And we send you an intake form that you just fill out on your form digitally. Like, please click these little buttons. It's super easy. So we're really trying to make it as easy for a guy as possible to access some of this stuff, and hopefully eventually we can do the hormones through there. That would be my goal.
That would be great. I mean, obviously being able to help people and to go, to go that step above kind of what your average, top 5 Google result will take you to. Not, they're not all bad necessarily, but they're more of like, this is patient A and patient B and patient Z all get the exact same prescription, and then we'll check your labs in 3 months and see what happens and see if it works, and then go from there. It's not more. I think that's more guinea pig medicine necessarily than what you guys are doing. Yeah, so I'd love to see that. Yeah, for sure. And I love the idea to be able to get the ED stuff easily, because it's such an embarrassing type. Yeah. It's something that has a stigma, just like testosterone does as well. Men's health is crazy. Because it's like, we're supposed to be big, strong men, right? And which actually makes us do stupid things like don't go see your doctor and get a wellness check, and, don't explore some of your symptoms. And then all of a sudden you have prostate cancer stage 4 because you're too lazy to go to a doctor once a year to check on this stuff, right?
Yeah.
So,
we find that, unfortunately, often. We uncover a lot of these things, unfortunately, because the guys have neglected it for so long. But yeah, really trying to break down the stigma and the association even between testosterone and erectile dysfunction, because just because you have low T doesn't mean you have erectile dysfunction. Just because you have ED doesn't mean you have low T. But we have actually an all-female staff as well. So, early on I was told that I was crazy for doing that. But what I found from other clinics in our market is they had an all-male staff, and that my husband was like, I don't know if I like that. So we flipped the script on that, and all females, and our patients love it. I mean, we have a more like nurturing nature about us as a female, and men are always running their healthcare decisions past the female in their life. So it's like, you can skip that step if you want to, because we're giving you approval, or we're giving you that reinforcement that you're looking for to tell you that you're on the right path of things. So it's worked out really well for us. So
that's crazy. That's actually, that's crazy in a good way. I love that idea. It's funny. I joke and say, well, I've been married 28 years. We just celebrated 28 years a couple weeks ago. I'll basically listen to any woman at this point to tell me what to do, because I assume that she knows better than me. But I think that's all super helpful. I don't want to keep you, forever, but I want to know about, this is kind of countercultural, right? Like your whole thing with women want strong men. Yeah. Right. So women want strong men. This is countercultural. I don't know what you think you're doing over there with
Yeah, I know. I had some friends unfollow me on Instagram and Facebook over the name of my podcast. I couldn't believe that. I was like, that's interesting. But yeah, so my podcast name is Women Want Strong Men, and I believe I named it that because I believe it does take a strong man to appreciate a strong woman, and I really view it as a sign of weakness from a man whenever they do some of these things that we've seen in the media, like this #MeToo movement, for example. That turned into this toxic masculinity thing, where I actually viewed it as the exact opposite. Like, that man was weak and insecure and not healthy and all of these things. That wasn't a masculine man, in my opinion. So I really think that men that are strong and confident and like to provide and take care of their partner can lift up their female to be the best version of themselves, and vice versa. And then the female wants to do that for their partner as well. So I think we can live together happily, and it doesn't have to be this one versus the other, which I feel like in the media these days you see a lot of. It's the men versus the female, whether it's in careers or politics or cultural norms, and it just divides us rather than supports us.
100%. I think we're continuing to teach women that in order to be successful, they have to act like men, and men are so freaking confused right now as to what they're able to be and what they're supposed to be. I can't imagine being a young man now, 18, 19, trying to figure out, okay, well, am I supposed to be Ken in this whole new stupid Barbie movie that came out?
I did not go see that.
I did not either. I've kind of heard enough from now, but it's very emasculating, very feminist, from what I understand. And, like I said, but I have this poster behind me that literally says, masculinity is not toxic. Some men just suck. right? Like it, you know.
Exactly. That's what I'm trying to say.
Yeah, so masculinity in and of itself is a good thing. I've talked about this on the podcast before, but my wife has spent the last 5 or 6 years working with all female automotive builds, welding, and you know, she was a stay-at-home mom, but now she's involved in this world of just what I would consider, like I said at the beginning, kind of this badass woman group, and it's crazy because the women in that group are like the strongest, most badass women that you will ever meet. But she and I kind of do everything together. So it's been really interesting for me because I consider myself like the traditional masculine, you know, more traditional in terms of like, not necessarily gender roles specifically, but like as the provider and the protector and all of those roles. But like to hear these women then talk about us as a couple later to say, I would love to have a relationship. Not I would love to have a husband like yours, but I would love for my relationships to look like your relationship.
Yeah, well, because I think just because you're this, quote, girl power or a badass and can, quote, provide for yourself or you don't need a man, that doesn't mean you don't need a man. You still want a man to give you that, you know, sense of security and protection and that strong. And just because you don't need them financially doesn't mean we don't need men altogether. And I think that's where this girl power confusion, just because I think it's something like 40-something% of women now are the breadwinner in the family. So cultural roles have shifted a little bit, but just because we're able to provide for ourselves and we're not relying on a man for that anymore doesn't mean we don't need a man. We still want a connection with a man. And so I think the lines have just been blurred a little bit there.
Yeah, I mean, it's like, it's so confusing right now. I mean, Michelle and I are like, our kids are 25 and 24, and like to try to raise, you know, how old is your little one?
He's only 11.
So he's 11. So you're getting into that. So, I mean, that's like, you've got a real challenge but you know, to be happily married and have a strong man to be able to teach. I think one of the problems that we have now is that men are not teaching their boys how to be men anymore.
Look how many families don't have men in the household.
Yeah.
That's a major problem. That's probably the number one problem. Look at the inner cities. I mean, they would say that's the number one problem our society faces is that there's no men in these homes raising their children.
Yeah, because it confuses, you know, it's hard on the single mom. It's hard on the kids because mom's trying to be both, and she's simply, it's not that she's not strong enough. Of course she's strong enough, but she's not equipped in the same way.
Yep.
You know, I got in trouble because one of my friends had posted a picture of him throwing his kid up in the air in a pool, like just literally just launching this kid. And I put on there, that's why kids need dads. And in my mind is because moms are more careful. Moms are, you know, moms are not the ones usually causing injury to their children. And I had all these people comment like, well, we need moms too, and women are just as capable. I'm like, shut up. That's like I just,
yeah,
it's not, it's definitely not an either or.
Yeah,
so
everything goes to the extreme.
Yeah. And I love that that's what you're doing out there because I think that's great education for men and women. And then I'm trying on this side of the coin, you know, to teach men that this is what masculinity can look like. Masculinity can be treating your wife with, you know, I open the door for my wife and I treat her with utmost respect and I, you know, cater to her in some cases and, you know, all of these things. That's why I've been successfully married for 28 years.
Exactly.
That, and she hasn't murdered me yet. But like, it's, you know, I want to teach them what true masculinity can look like, not just like this you know, the bro beat your chest and all that stuff, right?
No, I mean, like my husband's an alpha, I'm an alpha, and we can coexist perfectly together. Like we can balance each other out. Sometimes I need to be put in my place. Sometimes he needs to be put in his place. Sometimes I need, you know, attention and affection. Sometimes he needs it. I mean, so I think just teaching your children that it doesn't have to be an either or. You can both be successful. You can both have your own careers. You can both, help each other, open doors, hold hands, kiss. Like you have to be. It's important for your kids to see that and grow up like that.
Yeah, because it definitely, and I've talked about this before on the podcast, so if I'm repeating myself, I got a Father's Day text from my youngest. And my youngest and I have this a little bit of antagonistic relationship. She tends to be much more liberal than I am. And, you know, all of those things that your
I'm
kids
sorry.
turn out to, yeah, me too, turn out to be the exact opposite of what like you had in mind. But she sent me this text saying that how thankful she is to have grown up in a house that gives her a model for how a man is supposed to treat his wife. And like that to me was like, all right, I did my job, you know, in that case.
That's awesome.
Because we used to joke and I'd be like, hey, you know, I think it was a Cosby joke or something. It's like, I'll make 2 more just like you. I you know, understanding that mom is the most important one in the house, not the kids. And but yeah, that was something that really just stuck with me.
Yeah, I love it. That's great.
And having those particular roles. So, well, I appreciate you taking the time. I know you're a busy woman, being the alpha, you know, part-time alpha in your family. But how do we find you? How do we find more information if we're not in the St. Louis area, but we do want to kind of explore some of the sexual health stuff? Obviously, we can do that.
Yeah, so my email is podcast@amystuttle.com, and I'm sure you'll attach it in the show notes so you'll know how to spell my last name. And then our website's victorymenshealth.com. For the PDE5s, it's victoryrx.com. And for the women listening, the women's clinic is embodyherhealth.com. And I'm on social media as something Stuttle, my last name, but I can send you all that to attach in your show notes.
Yeah, we'll put all that in there. Yeah. And I guess I need to start shopping for St. Louis airline tickets so Michelle and I can come down and visit both clinics. So
1-2 punch.
I like it.
She can go there and you can come see us.
I like it for sure. Well, thank you so much, Amy. I hope you have an awesome day.
Thank you.
All right. We'll see you.
Bye.
If you're looking to really maximize your life and become the man you were made to be, head over to maxedoutman.com and get your journey started today.